Hi everyone, my name is Dinesh Sirasena, and today we're going to be talking about imaging the subscapularis tendon. As in my previous videos, I'd recommend these two resources for ultrasound imaging. Firstly, there's the ESSR guidelines on MSK scanning, and there's also ultrasoundcases.info. Here are the images from the ESSR guidelines. To scan the subscapularis, you have the elbow adducted and the shoulder in an externally rotated position. In the long axis view, you'll see the deltoid sitting on top of the bursa, which also sits on top of the subscapularis tendon, as it sits on top of the humeral head. The subscapularis, in that externally rotated position, comes from underneath the coracoid process. It's also important to image the subscapularis in a short axis view. Here you can see the multi-pennate view of the subscapularis with hypoechogenic areas in between the tendon pennations. Often when I'm scanning patients, I'll have them lying supine with the arm in an externally rotated position. It's much more comfortable for the patient, but also the added benefit is that it allows a lot more stable images when I'm performing the scan. Here is an example of the subscapularis tendon in a long axis view. The deltoid and bursa sit on top of the tendon, and the tendon itself sits on the humeral head. In some patients who are particularly flexible, or maybe even in young patients, you may see some of the muscle belly appearing from beneath the coracoid process. Here we have an image of the subscapularis in a short axis. And as mentioned in the previous slide, it has a multi-pennate view. To think about the multi-pennate view, sometimes I imagine the subscapularis as fingers, and it sits on top of the humeral head. And what you're seeing in the short axis view is a cross-section of these fingers as it comes and attaches onto the humerus. Similar to other tendons, you can develop tendinopathic changes in the subscapularis tendon. Here we can see loss of the normal compact fibrillar structure of the tendon, and instead it's replaced with hypoechogenic changes running through the tendon and thickening of it as well. With prolonged tendinopathy, or if there's any trauma, you can develop tears within the substance of the tendon. Here, within the body of the tendon, we can see a hypoechogenic and very well defined tear. But it's important when you're assessing the tear to not only view it in the long axis, but also the short axis to confirm it and also to gauge the dimensions of the tear itself. Thanks for watching, and I hope the video adds to your knowledge of ultrasound imaging and how you can use it in your clinical practice. If you did enjoy the video, please remember to hit the like down below and subscribe to the channel for further updates. You can also follow me on Twitter and Instagram, and remember to check out sportsmedinfo.sg. I hope to see you all very soon. Take care.